everybody, and welcome to episode 42 of CCA's Medical Minute, brought to you by Kroger Health. I am sporting a new hairstyle today. I would call this hair by chemotherapy.
Yes.
So, and I've adopted a new program, a new almost daily program, but it's my ball cap shout-out program, where I'm going to focus on gratitude and fun by taking each one of the about 500 ball caps that I have and remembering why I have them. The real reason why I have most of them is because I forgot to take a ball cap on vacation. And I would get up with the cowlick and I have to go get breakfast. And then I had the ball cap, so I'd buy that. So that's why I have most of them. But they all have a good memory. So anyway.
The head looks good.
Thank you.
I like it.
I don't know about that. It's pretty shiny right now. So you're not thinking Dr. Evil?
I'm not thinking Dr.
Okay,
Evil.
all right.
I mean, unless you.
Yeah. Nothing a little sunlight won't help. So you make sure you get a little vitamin D.
I'm going to try to do that next
week. We
week.
could probably powder to take down some of the glow, but
I'm going to try to do that next week.
Why don't you remind people of why you said chemo, but there are some folks that might have missed a couple of
okay,
episodes.
that's true. Yeah, so I've successfully been able to fight off chemo for about 9 years now, and done pretty much everything else. Got my money's worth on this whole journey, but we're finally at the point where chemo is probably the most effective therapy that I can use. We may or may not fully complete it, and so there's a possibility I may switch to a new therapy at some point in time. But that's the beauty of where we're at, is that there are many things
Lots of
available.
things.
So yeah,
it's a stepping stone.
Yep, exactly. So what we wanted to talk to you about today is kind of a recognition of the fact that since we first talked about what we call Cancer 101, we have lots and lots and lots more subscribers. So most people probably didn't even see that first episode. And so we thought we'd kind of take a step back and just really address that at a pretty high level. And so, Jill, I guess my first question for you is, I think about my experience where I was asymptomatic. My cancer was found as a result of a routine 50th birthday, doctor's visit.
Surprise!
Yeah, exactly. Well, the surprise, actually, there was a surprise moment.
I can imagine.
Called the DRE, but we're not going to talk about that. But anyway, like in your experience, how many people that come in that have been diagnosed with cancer, is it a total surprise to? Is it a lot or is it a little? Or
I would say probably in the 30 to 40% range of people who come in who it's picked up on either a screening or they call it an incidental finding where they're having a scan for something else completely unrelated and they find a cancer diagnosis. I do find that the patients who come in who were totally healthy, or so they thought prior to being diagnosed, they really do have that deer in the headlights just completely, blown over because they're just shocked from the diagnosis.
I was shocked. I was one of those people because I wasn't in for a routine or anything. It was just for me advocating, trying to make sure that I was really healthy and asking for something else, to breast MRI, so that I could get yet another kind of baseline that would be separate from the 3D. And lo and behold, I was diagnosed with breast cancer, which brings us to another part of this particular episode. We want to talk to all of the folks at home. We have newly diagnosed people that will be diagnosed, and you need to know some of the things that you should be asking. And I think the no-brainer, Jill, is one of the first things I said. And aside from, what kind of cancer is this? Actually, I said, am I going to be all right?
Well, and that's the thing that is really difficult. And as we have talked in previous episodes, and the way that Dr. Lemming and I have always practiced, we approach every single case, despite the diagnosis and despite the staging at diagnosis, that you are curable until proven otherwise. And so it might not mean that it's going to be an easy road to get there. And it might not be very fun, as you could potentially attest to.
Yeah.
But if we all are approaching it with we're going to fight this, and we're going to fight this like we're going to try to cure you.
Yeah.
Because if we go in with a timestamp and tell you that you have 18 months to live, number one, we are not God.
Well, more people are living today with cancer and after a cancer diagnosis.
Well, and there is so much research that's being done. And so right now, for any cancer diagnosis, there are several lines of treatments and clinical trials that are out there. And a lot of the approach is we just need to get you through until the next thing comes along.
Yeah.
And, you know, a lot of patients will come in and they have I don't want to be on some form of treatment the rest of my life.
Yeah.
And the goal for us as clinicians is for patients not to be on treatment the rest of their life. But we're trying to give them quality and quantity. And sometimes that comes with a price tag.
Yeah. Yeah. You know what? And real quick, Sherry, there's something I don't want to forget to ask this because I'm already getting the early stages of chemo brain. You and I talked about that because that happened last week where I just kept trying to remember the question and it took me like 3 times before I did. But we talked about this on our first podcast, and I just want to make sure because you often hear people say, we're gonna cure cancer. We're gonna. I mean, how realistic is that? Because you've got trillions of cells. Some of them divide erratically. So, I mean, really maybe explain how that works. And then is really the best hope just to be able to manage this disease? I mean, you can't really ever keep cells from dividing erratically, right?
Correct. And I would love to say that at some point we make cancer a chronic illness.
Yes.
That is manageable and that you can live with. But the reality of it is that if you think of all of the different cancer types that there are, and then you think of all of the subtypes within that type of cancer, the number is staggering. And I don't think that people quite understand that. Like, to say we're going to cure cancer is like saying, I mean, literally, like, we're talking hundreds of different types of cancer. That it's just, there is not going to be a blanket cure.
Exactly.
So then, Sherry, so where I think that brings us to is that as survivors, so you can't, certainly clinicians cannot cure it 100%.
Well, there are some cancers
that
are curable.
But what I mean, the disease is a blanket.
Right.
You can't just make cancer go away because cells divide in crazy ways.
Right.
But I think with improved care and treatment, it puts a bit of an onus now on the patients.
Yeah, it really
does. For
does.
earlier screening because those tools are available. So it's really a shared thing. I mean, you can't just kind of wait until things are going really wrong, then go to the doctor and say, get me out of this jam.
Well, and you can't be in a situation like Sherry, you were such an advocate for yourself. Your mom had died of breast cancer and you knew what your risk was. And so you were pushing just to make sure that you got that higher level of monitoring to make sure that you would catch things early.
Yeah.
I've taken care of patients who have gotten a colon cancer diagnosis that were in their 60s, who had never had a colonoscopy and had a strong family history of multiple people in their family having colon cancer.
Well, I've experienced many women since my diagnosis of people calling and connecting with me that are over 40 and have never had even a mammogram, baseline mammogram. So this conversation is very important to say, you check yourself, and if something is different that you need and before the ages of the different screenings, then you just go to the doctor, and that's how you broach that. But if you're of the screening ages for colon cancer, breast cancer, or any of the other cancers, you do yourself some justice by going to get those screenings and starting that process. So, you know what? Before we continue on, I want to go over some questions. Like we say, what should you be asking? Of course, we said, what type of cancer do I have and where is it located? Then you ask about the staging. And it's important that you ask, what does the stage mean? Because sometimes they'll say you're stage 1, 2, 3, 4. You need to get an understanding from your oncologist as to what the stages mean. Then I would say, you want to ask if there are any other tests that you need to get diagnostics, because sometimes there are and there will be. I was shocked once I was diagnosed. It seemed like I was in a doctor's office for 2 weeks straight.
Yep.
Getting various diagnostic tests. So you want to know what those testing methods are. You also want to ask about maybe even your own heredity and genetics, because if you have children, you want to make sure that you get this information so that they'll have it for their futures. You want to ask if you're a woman, even man, about having children, Jill, because sometimes when you're diagnosed with cancer, it may have some kind of effect on whether or not your fertility, you're able to have children.
And the hard part is, especially for our younger population, and we talked about this a little bit when we talked to some of our Hodgkin's disease patients who are diagnosed at a younger age. the having children, if they don't have any, in the face of a cancer diagnosis, at that moment seems like something that I'll deal with that later. Like if I'm infertile, then it is what it is.
Right.
And then they get through their cancer treatment and it's too late.
Yeah.
And you don't have the option to change your mind.
Yeah.
So understanding that it's okay to kind of halt and take a deep breath, and it's okay to look into what you need to do fertility wise, whether that's, sperm banking or egg preservation, all of the things that are important to do that truly will impact your future.
Yeah. So I guess the punchline is really, when you get right down to it, is whereas you do routine like wellness care, but maybe we're at the point, because so much is available, that you need to really be thoughtful about, how do I proactively assess whether I have a cancer risk, or
Right.
What are those screenings options? How do I get access to them?
The big thing is, and I would say this to any healthy, somewhat healthy, maybe not so healthy human that walks this earth, you got to get in the game.
Yeah.
You can't sit on the sidelines and think that it's going to be fine. You've got to get in the game.
Yep. All right. So I think maybe we'll wrap up for now, but I think we got to come back to these types of topics every once in a while, because I think sometimes we get a little specific about things, not doctory, but specific, and I think this general discussion sometimes is good. So I'll close with my ball cap shout out. This is Ballyfin Resort in Kenmare, Ireland, #1 resort in the world multiple times. I've been there, and I didn't even pay for it.
And they didn't ask you.
Nice.
They're not paying you for saying that either.
No, they're
That's
not.
just
They're not. My friend Damien Bastiat, I don't think he has budget for that. So anyway.
Nice.
But anyway, thanks everybody for tuning in to episode 42. We'll see you next week for 43. We'll see you Wednesday at noon. And have a great week, everyone.